Hi, my name is Michael Reinhorn. I'm a hernia specialist at Boston Hernia, and today I'm going to talk to you about what to expect a month out and later after umbilical ventral hernia repair in our practice. You're about a month out from surgery. This is when we see you after surgery in the office. By this point, you've gone through all the hard part of the transition, that initial week where there's a lot of pain, the second week where your pain has improved, the third and fourth week when you slowly increase your activity level. And in a month, you should be back to baseline almost. I would say about 9 or so out of 10 patients are back to where they want to be at a month, and about 1 in 10 patients is just taking a little bit longer. At this point, you'll come in for a post-operative visit. We will take a look at the incision to make sure it's healing okay. The incision typically will have some glue on it that still has not washed off. There will be hardness and swelling at the incision site. That hardness and swelling will eventually go away, but it's part of the body's healing process. And if you're still feeling that, don't be alarmed. It's normal and expected. And then at this point, if you haven't resumed all physical activity, you absolutely should. We'll give you that go ahead in the office setting and just give you the okay. We'll examine for a recurrent hernia, which is rare. And then we kind of send you off your way. At this point, the follow-up that you will have with us is that you will have filled out a post-operative assessment from the ACQHC, that's our National Hernia Registry. You will have done that a month after surgery to see where you are at a month. But we'll send that out to you again via text or email at 6 months and once a year after surgery. It's super helpful if you fill those out so that we can follow you long term, understand how you're doing, and if something doesn't seem right, that's a really good reason to give us a call. But generally by 6 months or so, the swelling is completely resolved after the hernia surgery. If you are going to expose that area of skin to direct sunlight, and whether it's summer or a beach vacation, it's important to either cover it up or place a Band-Aid or a zinc-based sunscreen, or else the scar becomes hyperpigmented in that first year. Other than that, you should be looking for trends in your body and generally feeling better. If something doesn't seem right, pick up the phone and come back in and see us. It is important for us to examine you to see how you're doing.